Hello friends, so in this video let us learn about curriculum revision. It is the most important aspect of any curriculum and any institution or the universities planning to have some changes in their curriculum according to the needs of the society or according to the needs of the students or adopting any changing scenarios. So in that case this curriculum revision is most important and it plays a vital role in changing the behavior of the students as well, of the learners. So let us see what it is all about. If you see the definition of curriculum, it is nothing but it is a master plan for selecting the content and you're going to organize the learning experiences for the learners and the ultimate aim or the purpose of this selecting the learning experiences or organizing the learning experiences is to have some changes in the behaviors of the learners and insights. So that is a main aim and objective why we are doing this or why we are implementing this curriculum for the students. So it is nothing but it's a master plan. So any institute or any university, any organization offering this curriculum must have the master plan with them based on the aims and objectives of the institution. Secondly, it's also the totality of the student experiences that occur in the educational process. So it includes everything as we have seen in the introduction. It includes the organization and selection of the learning experiences. It may be theoretical or it may be practical aspect and addition of any other additional subject as well according to the interest and the need of the students. So it is overall the totality of the student experiences is covered in the curriculum. Now what is curriculum revision? So it is something you're going to make some changes in the curriculum which is already there. The existing curriculum is going to face some changes. Either you're going to give a new position or you're going to change the direction of the curriculum, right? So it may happen in its philosophy, the basic rules of the curriculum you're going to do some changes, right? So the institution may have new philosophies or have some new aims and objectives. So they are coming out with some new content that can be included in the existing curriculum or some of the things need to be revised and maybe the committee is rethinking about its evaluation process. So collectively, if you want to add or enhance the curriculum content in terms of addition, deletion, revision, re-evaluation process, so everything is included in this curriculum revision. So it is nothing but anything to be introduced newly within the existing curriculum or to be changed or to be modified or to be altered according to the changing needs of the society as well as the needs of the students. Now, why we need to change this or why we need to go for this curriculum revision, whether it is important and when it is necessary. Let us see. One is it is required because according to the needs, interest or abilities of the learners. Here we have to focus on the students only. Here the learners are anybody, any students. So restructuring of the curriculum is important because their needs are changing every year or every month and everything is changed in the surrounding atmosphere. So the students also need to be modified according to that or they have to adopt themselves with the changing scenarios. So every year there are some changes happening in the curriculum or new things are adopted. So it has to be revised at least once in a year or every 6 months if possible. So restructuring the curriculum is needed according to the needs and interest of the learner. Secondly, so maybe the old syllabus if it is still followed and the things are very old and it is no more it is necessary or it is not at all having any significance related to the curriculum, then those things can be eliminated from the curriculum. So it helps to add the new things or the things can be updated or it can be replaced also. So for that also this curriculum requirement is needed. And next is when we are in the process of adding new things, latest informations which is not available in the curriculum because the curriculum is not at all revised for several years, but it is the need of our that we have to introduce the latest things and the updated informations to be added into the curriculum. So in that case curriculum revision is the best option. Similarly, if you want to add some content or if you want to delete some content in the existing curriculum, it is related to the teaching instructions or increasing the hours of theory or increasing the hours in practical areas or any units to be added or any subjects to be introduced. So anything can be possible in this curriculum revision. So when we plan for this curriculum revision, it is either you're adding something or you're removing something or you're restructuring the existing curriculum, then it is called curriculum revision. And next is, if you want to correlate between the students' theory hours and the learning practices, then it is important that you have to revise the curriculum, because if it is not matching or if it is not fixing the issues of the students theory and practical areas, or the practical hours are not matching with theory, or it is it is found that it is inadequate, the students or the learners are not able to fulfill their clinical requirements or clinical practices. In that case, the curriculum can be revised. And finally, to select the learning experiences based on the objectives rather than on the service needs of the society. So here we focus on the learners only, because they are all the society members and they are going to change the society in future. So the focus is mainly on the learners. So what is required for them? So what kind of experiences they are going to obtain from the institute or by going through the curriculum. So based on these things only, this curriculum revision will be done. So in order to achieve this curriculum revision, we have three aspects in our hand, or three approaches we have to follow. One is addition, second is deletion, third one is reorganization. So it is nothing but the first concept or the first approach is about addition. Addition is you are going to add some new content into the existing syllabus, where you feel that the content is or the existing syllabus is inadequate to fulfill the learning experiences of the students. So in that case, you feel that yes, adding something into the existing syllabus may enhance the knowledge level of the students either in theoretical area or in practical area. In that area, you're going to add some content. Maybe the number of hours is you're going to increase in theory or practical, or some units you're going to add that helps the students or the learners to know more about the subject matter. Okay, so that is addition. Second is about deletion. Deletion is you feel that this unit or this topic is no more required, or this can be modified, or it can be replaced. So in that case, you are deleting those particular unnecessary topics in the particular subject or in the particular unit, that is completely removed, or you're eliminating or you're deleting the topic from those subject. So maybe you may have another option, you can replace it, right? So with that unit, for example, if you are deleting 4 hours of unit from any one particular subject, and you may have a replacement that you are adding with the same duration of hours with another unit, you are going to replace it. Okay, this is called deletion. Third approach is called reorganization. Reorganization is here addition and deletion is not happening in reorganization. Reorganization is completely about restructuring the curriculum. The entire curriculum is going to be restructured, but there is no addition and deletion processes happening. So this can be restructured. Maybe the units are changed here and there. You are not going to delete it and you are not going to add it, but the arrangements or the placement may be changed, and completely it is restructured, right? So maybe unit placements may be changed, or some of the topics can be changed here and there, but there is no changes in the number of hours or the duration of the theoretical or clinical experiences. Okay, it is only about restructuring the existing curriculum in order to give some shape to the curriculum. So we have three approaches: addition, deletion, and reorganization. So let us see how this curriculum revision is exactly happening. So we have some stages. In stage one, what is happening? Any institution or any universities must have this curriculum development and evaluation committee. So the committee only decides whether this revision is required, or it is the need of the hour, or it is not at all required. So first stage is establishment of this curriculum development evaluation committee. So if it is already there functioning, then they can proceed with that, or if it is not established, the institution must have this curriculum development committee and curriculum development and evaluation committee in order to proceed with this curriculum revision. That is stage 1. And in stage 2, once the committee is formulated, so what they have to do is they have to apprise the existing nursing and education standards, whether it is sufficient or whether it is having content, whether it is rich enough to feed the students or the learning experiences are sufficient or adequate for the learners. That has to be apprised why there is a need for this curriculum revision at this moment. Okay, so existing practices including theory and practical has to be evaluated by the committee. Then the committee will decide and it will go further to the stage called stage 3, establishing criteria for revision. So once they feel that yes, curriculum revision is required at this moment because there is a need and there is a recommendation, and they feel that after the evaluation of the existing curriculum, if it is required, it is mandated to revise the curriculum, then they set the criteria for the revision. Okay, how much it is required, or in a balanced manner, including the theory and practical hours, or adding the subject whatsoever. So the establishing criteria is the stage 3. It is set or decided by the curriculum development and evaluation committee. And stage 4 is all about once the criteria is set, then they are moving forward with the designing of the new curriculum by adding the new philosophy of the institution and with the new aims and objectives and purpose of the institution, the design will be happen, right? So the curriculum committee only will do these things, and once the curriculum is designed, they will just go through once whether the new philosophy, aims and objectives is incorporated or not. Okay, that is again important. So that is stage 4, designing the new curriculum, keeping in mind that the new philosophies, aims and objectives of the institution is incorporated. And in stage 5, once the curriculum is designed, it will be implemented. Okay, with the necessary changes done, or the revised curriculum is now implemented, and with that stage we are not going to stop it. Once it is implemented, we have to see whether it is fulfilling the needs of the learners or not. So, okay, that is stage 6, called review and revising the curriculum. Okay, simply you can say it is called evaluation. What is evaluation? Once the new curriculum or the revised curriculum is implemented, there may be flaws, there may be some lacunas, so that has to be rectified again by doing this review and revising process. Okay, this also will be done by this curriculum development and evaluation committee. So these are the basic 6 stages to be followed in order to do this curriculum revision, right? So that is all about this curriculum revision.